In recent months, public health leaders have said one benefit of getting the COVID-19 vaccine is that fully vaccinated people won't have to quarantine if they're found to be close contacts of someone who tested positive. However, local health departments across Montana are now considering whether they'll need to change that policy in light of a state law that prohibits discrimination based on vaccine status.
We have had to make some adjustments to our operations in order to balance the CDC recommendations around quarantine and the restrictions placed upon the situation.
The CDC has issued updated guidelines saying close contacts who are fully vaccinated only have to quarantine if they develop symptoms. But House Bill 702, approved by the legislature earlier this year, says government agencies can't deny anyone advantages or privileges because of their vaccination status. Lewis and Clark public health leaders say to stay in line with that law, they're no longer issuing quarantine orders for anyone. Instead, they'll send close contacts a letter asking them to follow public health recommendations. Quarantine if they aren't vaccinated, and masking and testing if they are.
The message is essentially, we need this community to follow these instructions if we want to get past the negative impacts that we're experiencing with COVID.
Lewis and Clark County Health Officer Drenda Neiman felt the only other option to comply with the law would be to require everyone to quarantine for the same length of time.
If we were to quarantine fully vaccinated individuals, we have students out of school that don't need to be, and we have workers out of work that really don't need to be, and which has a pretty significant snowball effect within our communities, and it's quite disruptive.
Many health departments across Montana are considering how to address this same issue. Some are taking a different path. Missoula's Board of Health has decided to keep quarantining unvaccinated close contacts, but not vaccinated ones. Board members acknowledge that could lead to a lawsuit. For the next few weeks, it's likely that not every close contact in Lewis and Clark County will even receive a letter with recommendations. Public Health has shifted their contact tracing strategy to focus on household and high-risk contacts, saying they don't have enough staff to fully trace all the new cases in the area. Neiman asks that anyone who knows they've been exposed to COVID follow the recommendations anyway. In Helena, Jonathan Amberian, MTN News.